pan the room real quick to show the supplies. All right, and pan back to me. All right, knock, knock, knock. I'm gonna come in. Hello, my name is Blake. I'm gonna be your nurse today. I'm gonna be doing an assessment on you head to toe, if that's okay with you.
Yes.
Okay, and then I'm going to wash my hands with hand sanitizer, and I'm going to put on some gloves. Alright. I'm just going to do a general assessment so my patient is in a good mood. Their posture is good. There's no abnormalities there, no physical abrasions or lesions that I can see right now. When they walked in, I could see their gait and it was well coordinated and smooth, and there was non-metalgic. And then my patient is alert. Can you tell me where you are right now?
Durham, North Carolina.
Okay, and can you tell me when your birthday is?
January 13th.
Can you tell me your name?
Peter Carapello.
All right, and can you tell me what year we're in?
2023.
Okay, awesome. So patient's alert and oriented ×4. And then is it okay if I assess your scalp real
Yes.
quick? All right, so we'll start the head to toe. I'm gonna take a look at your scalp. So there's no infestations, no lesions. And then is there any tenderness when I press down?
No.
No? Okay, good. All right. And then I am going to take a look at your jaw real quick. So I'm going to press down. Is there any tenderness?
No.
No? Okay, I'm gonna have you open and shut your mouth. All right. All right, so there's no clicking. And is there any pain when you do that?
No.
No? Can you press down on my hand? All right, so there's good full range of motion. And then clench down real tight. All right, so it's very strong right there. All right, looks good there. And then I'm going to take a look at your eyes real quick. So can you close your eyes for me? All right, so there's no lesions on the eyelids. The skin is appropriate for ethnicity. You can open your eyes for me. So there's no lesions there. And then there's no lid lag. And then your cornea are white, and your conjunctiva are pink, and your your sclera are white, your corneal are clear, and your conjunctiva are pink. And then I'm going to take a pen light and take a quick look at them real quick. So let me grab this pen light, and they are about a 4-year pupils. And then I am going to shine a bright light in them real quick, okay? So, all right. All right, pupils are reactive to light. And then I'm going to have you look at my pen light and then look over at the wall behind me. All right, and they get bigger appropriately. So there is, and then hold on 1 second. Let me take a look at them one more time. All right, and so both of them constrict at the same time. So there's conversion and accommodation. And then I'm going to have you follow my pen for me, okay? Just your eyes. Awesome. All right. All right, so you can stop following. EOMs are intact and there's no nystagmus. And then I am going to take a look at your ears real quick. So I'm going to inspect the outer ear real quick. All right, and so there's no redness, no lesions on the ears, and they are a good shape. They're symmetrical, and it's a good shape on this right one. There's no lesions, no redness, no swelling on either side. All right, and then I'm going to take a look at the external canal. All right, there's no redness, no drainage coming out from there. I'm going to press down real quick, is that okay?
Mm-hmm.
All right, so I'm gonna press on your tragus. Any tenderness?
No.
Nope, and then your pinna, any tenderness?
No.
All right, and then I'm going to take a look at your external canal over here. There's no redness, no swelling, no drainage on this side either. I'm gonna press on your tragus. Any tenderness?
No.
All right, and I'm gonna press on your pinna. Any tenderness?
No.
No, okay, any tenderness? No, okay. And then I'm going to do something called a whisper test. So I'm just gonna have you cover your right ear real quick. And I'm gonna whisper 2 ears and you're, 2 ears. I'm gonna whisper 2 ears. I'm gonna whisper 2 words and you're gonna repeat them back for me, okay? All right,
Daydream basketball.
okay. And then I'm gonna have you cover the other side. And then I'm gonna whisper 2 words and you repeat them back to me, okay?
Picnic basketball.
Okay, awesome. So hearing is good. And then I am going to take a look at your nose, okay? So nose is symmetrical, there's no lesions on it, no abrasions, and the shape is good. And then I'm gonna look inside of your nose. So I just need you to lift your head up, all right? There's no lesions and or drainage, no lesions, drainage, no deviated septums, anything like that. You can put it back down for me. And then I'm going to check your sinuses real quick. So I'm gonna check your maxillary sinus. All right, any tenderness?
No.
No. I'm gonna check your frontal sinus. Any tenderness?
No.
All right, temporal?
No.
Nope, no tenderness?
Nope.
Awesome. And then what I'm gonna have you do is cover your left nostril. All right, and can you breathe in deep for me? Awesome, word. And then can you cover your right nostril? Breathe in deep for me. All right, so your airway is patterned bilaterally in your nostrils. And then I'm going to have you take a smell of something. So I'm gonna have you close your eyes. All right, and can you tell me what you're smelling?
Alcohol.
Okay, awesome. And so your sense of smell is intact. You can open your eyes for me. And then I'm gonna take a look at your mouth, okay? So the lips are pink. There's no lesions present. They're symmetrical, all right? And then I'm gonna have you open your mouth for me, all right? I'll just have this just in case. Let me take a look. Tongue is pink, moist, and there's no lesions. Lift up your tongue, yep, pink, moist, no lesions. The mucosa around there is pink, moist, and no lesions. There's no missing teeth and or cavities or teeth decay. I'm going to just lift this down real quick. Your gums are pink and they're moist. There is no lesions. And then also your pharynx is pink, moist, there's no lesions back there. Your tonsils are small, they're symmetrical, pink, moist, no lesions, no swelling, no redness back there. And then your uvula, I'm going to have you, it's midline, so I'm gonna have you say ah. All right, uvula rises and falls midline, that's good. And then I am going to take a look at your neck real quick. So I'm going to inspect it real quick. Can you just lift your neck up just a little bit? All right, perfect. So trachea is midline, and there's no lesions or any discoloration on the neck. So I'm going to have you can lower it a little bit more and look straight at me. I'm going to check your lymph nodes. So I'm going to check your pre-auricular, and then I'm going to check your post-auricular, and then I'm going to check your occipital. All right, and then I'm going to check your parotid, and I'm going to check your tonsillar, and then I'm going to check your submandibular and your submental. All right, good. And then I'm going to check your anterior cervical, and we'll go down, and your posterior cervical, we'll go down. All right, looks good. And then we're gonna check your supraclavicular, and those look good too. All right. And then I am just going to feel your carotid pulse. All right, +2 on this side. I'm gonna check it over here. All right, it's +2 on that side. And I'm going to just take a listen for bruits. All right, it's on this side. No bruit. All right. No carotid bruit. I'm also just going to take a list to your upper airway. Sounds good. Nothing going on there. That's good. And then I'm just going to go behind you and I'm going to feel your thyroid, okay? All right. So what I'm going to have you do is flex your neck down. All right. And I'm going to push on both sides one at a time, and I'm gonna have you swallow, okay? So can you swallow for me? All right, that's one side, and then swallow for me. That's the other side, all right. And it looks good there, no issues. Any tenderness or anything?
No.
No, no masses, that's good. And then I am going to assess your skin on your shoulders and stuff like that. Would you mind taking off your shirt for me?
Sure.
Awesome. And I can put this over on the side. Thank you.
Thank you.
All right. So I am going to start with your back first, okay? So I am going to take a look and inspect. There is no lesions, no redness, no abnormalities on your back. And then I am going to take a listen to your back. And I'm gonna listen in 10 different spots back here. If you wanna come back here and film where I'm. Okay, and I'm gonna take a listen. All right, ready? Deep breaths. Okay, 1, 2, 3, 4, 5, 6, 7, 8, 9, 10. Okay, that looks good. It was symmetrical, no issues there. And then I'm going to take a listen on the sides of your lungs just to be safe. All right, so if you could lift up for me. All right, I'm gonna start here. Nice deep breaths. Okay, and then here. Okay, here. And here. Okay, and then I'm gonna take a listen over on this side too. So 1, 2, 3. You feeling okay? All right, just making sure you're not getting lightheaded. All right, and then I'm going to inspect your front. All right, so there is no lesions on your front, and the skin is appropriate. Your chest rises and falls symmetrically. And I am going to take a listen real quick to your lung sounds. All right, so I'm gonna go in 8 different places. All right, and if you start feeling lightheaded, you can slow your breathing. 2, 3, 4, 5, 6, 7, 8. Okay. 10. All right. I took 2 more. I'm sorry, but just wanted to make sure. And then I'm going to take a listen to your heart sounds as well now. All right. All right, so I'm going to take a listen to your aortic, and then your pulmonic, all right, Erb's point, okay, and then tricuspid, and then mitral, okay. And S1, S2 are present. There's no rubbing, no clicking, and no murmurs. So that is all good. And then I'm just gonna inspect your shoulders, which look good. Awesome. I'm gonna inspect your arms, and I'm gonna have you go up. Awesome. Inspecting. All right. So there's no redness, no lesions, no skin changes. Awesome. No skin changes. The armpits, no skin changes. Awesome. So looks good there. And then I'm going to take a look at your nails real quick. So they are round, they're smooth, and they are pink. I'm gonna take a look at this side, round, smooth, and pink. So shoulders, arms, hands, all look good, no lesions, and your fingernails are round, smooth, and pink. I'm gonna check your cap refill real quick. All right, less than 3 seconds. Less than 3, 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 less than 3. All right, good. And I'll just have you relax down. I'm gonna check your brachial pulse. All right, +2. And I'm gonna check your radial pulse on this side. All right, +2. And then I'm gonna check your brachial pulse on this side. All right, +2. And I'm gonna check your radial pulse on this side. All right, +2. All right. And then what I'm gonna do real quick is just test sensation. So I'm gonna have you close your eyes. Can you feel me touching you?
Yes.
Okay. Can you feel me touching you?
Yes.
All right. Can you feel me touching you?
Yes.
How about now?
Yes.
All right. Also, I'm gonna touch your face. Can you feel me touching you?
Yes.
What side?
Left side.
Okay. What about now?
Right side.
All right. What about now?
Right side.
Okay. What? Right. What?
Right arm.
Okay. What about now?
Left arm.
Okay. And then I would normally have you undressed, but since you're not, I'm also just gonna test sensation in your legs while I'm here. All right. Can you feel this?
Yes.
Okay. And can you feel this?
Yes.
How about now?
Yes.
Okay. How about now?
Yes.
Okay. Perfect. And then I'm going to keep your eyes closed. I'm gonna poke you with something, so it might be a little bit sharp. Can you feel this?
Yes.
Is it sharp or dull?
Sharp.
Okay. How about now?
Sharp.
Sharp. How about now?
Sharp.
Okay. How about now?
Sharp.
All right. And then I'm going to test sensation in your legs as well. So how about now?
Sure.
All right. And that would be on your skin, of course. How about now?
Sharp.
Okay. And how about now?
Sharp.
This will be on your skin as well. And how about now?
Sharp.
Okay. How about now?
Sharp.
And now?
Sharp.
Perfect. All right. So then what I'm gonna have you do is pull me in. All right, pull me in. Oh, okay. 5 out of 5. Push me away. All right. What I'll have you do is bend your by the elbow and try and push me away. All right. And then pull me in from the elbow. All right, good. So biceps are 5 out of 5. And then what I'm gonna have you do is lift your biceps up. All right, towards you. Looks good. Push them down for me. All right. And then I'm gonna have you hold them like this. And then I'm gonna have you pronate them. So go inwards. Awesome. And then go outwards. Awesome. So full range of motion. That's great. And then I'm going to have you flex your wrists down. All right. Flex them down and push. All right. Good. Push them up. Extend them. All right. Extend them all the way up. Range of motion is good. You're 5 out of 5 on those. And then I'm going to have you go radial deviations. So that's in. All right. And then ulnar. That's out. Awesome. So full range of motion. You're just going to go with your hands, like kind of push out. All right. That's awesome. Okay. So then I am going to have you lay down for me because I've already done your chest and your back. So I'm going to take a look at your abdomen now, okay? All right, I'm going to lay you all the way down. Is that uncomfortable?
Nope.
No? Okay. All right, and I'm going to put your feet up real quick too because it's going to help me out. Oh, that's loud. All right, so first thing I'm going to do is inspect your abdomen. So I'm taking a look. It doesn't look distended, it looks flat. There's no previous surgical scars. There's no obvious signs of distension. The patient has shown no signs of distress at all. And so I am going to take a listen real quick to your bowel sounds. All right. Okay. And I would listen to for a minute in each quadrant. All right. Bowel sounds are present in all 4 quadrants and active. And then I'm going to just take a listen for bruits. Okay. All right, so I'm listening to the aortic first. All right, no bruit present. And then I'm listening to the right renal, no bruit present. The left renal, no bruit present. The right iliac, no bruit present. All right, and the left iliac, no bruit present. All right, and then I am just going to percuss. So you're gonna feel a little strange. I'm just gonna tap down. All right, and we're getting timpani. All right, so timpani, that's a good sign. And then I am going to palpate, and I'll start light. You just tell me if there's any pain or tenderness, okay? All right, any pain or tenderness?
No.
All right, any pain or tenderness?
No.
Any pain or tenderness?
No.
All right, I'm gonna go deeper. Any pain or tenderness?
No.
All right, any pain or tenderness?
No.
Any pain or tenderness?
No.
No, okay. And then normally I would check the inguinal lymph nodes as well. And then I am going to have you sit back up. Sorry, I can help you out with that. All right. Thank you. Appreciate that. Oh, one thing that I forgot, I want to measure from the back your AP and 2 transverse. So I'm just gonna have you stay still, and we've got about 35 centimeters. All right, and then I'm gonna have you lift up your arm for me real quick, and about 18 centimeters. All right, so about 1 to 2, so that's good. And then I'm just going to check reflexes real quick. So I'm going to have you relax this arm right here real quick. So I'm gonna do the brachial radialis. So real quick, all right, +2. And then I'm going to have you relax your arm up here for me. I'm just gonna tap on my finger right here, and this is gonna be your bicep. So +2. And then I'm gonna have you lean your arm back. And so I'll test your tricep. All right, so +2. And then I'll go over here and I'm gonna do the same thing. So your brachial radialis. So I'm gonna check it, +2. And then I'll have you relax your arm up on me. All right, and I'll check right here for your bicep. All right, +2. And then I'm going to check your tricep. All right, so +2. All right, and then I'm going to check your lower extremities now. So I'm going to inspect them, and normally your clothes would be off. So I would be assessing your lower extremities. So the skin looks normal color for ethnicity. There's no redness on the skin. There's no varicosities. There's no, the hair is equal on both sides. There's no lesions present on any of this. And then I'm checking your feet too. There's no lesions present. No varicosities, and on this side too, no varicosities. Your toenails are round and smooth, and the toenails are pink, and also your fingernails are round, smooth, and they're pink, and there's no clubbing present on either of them. And then I am going to check for edema, and there is no edema present. And then I'm gonna feel your dorsalis pedis. All right, and I'll check one at a time. All right, +2. And I'm gonna check it over here, +2. And then your posterior tibial. All right, that's +2. And then I'm gonna check your posterior tibial, +2. Awesome. And then I'm gonna check your pedal. All right, +2. And then I'm gonna check your pedal. All right, that's +2. All right, and then we checked sensation already. And I'm just gonna check your cap refill. So +3, less than 3 seconds, 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 and less than 3 seconds. All right, so cap refill looks good. I'm gonna have you push out, all right, and then push in. All right, can you lift your knee up for me? All right, good, and lift it up here. Awesome, good. Press down with it. All right, and press down. All right, looks good. And then I am going to have you flex your ankles up, all right, and flex them down, all right, and then I'm going to have you rotate them in, all right, and rotate them out. All right, good. So we just did flexion, extension, inversion, eversion, and then I'm going to have you stand up, All right. And then I'm going to have you, if you can hold on to me if you need, I'm going to have you kick your right foot forward. All right, good. And you can step forward. Okay, back. And then I'm going to have you step back with it. All right, and then forward. Awesome. I'm going to have you abduct, so I'm going to have you go outwards and then back in. Awesome. And then I'm going to have you go over your left, okay, and back in. Perfect. So you just did abduction, adduction. You did flexion, extension. So I'm going to have you rotate externally. All right, good. And back in, and I'm going to have you rotate internally. All right, good. And then I'm going to have you do the same thing with the other foot. So I'm going to have you kick forward. Okay, good. And then I'm going to have you step back. So move back. Awesome. So good range of motion there. And then I'm going to have you abduct. So go outwards with it. All right, and back in. Okay, and then I'm going to have you go over the other foot. Okay, and then back in. And then I'm going to have you externally rotate. All right, good. And then internally rotate. All right, good. So full range of motion there, and I'll have you sit back down. And if you want to put your shirt back on, you can put your shirt back on. And then I would do a breast exam. So I would first inspect, well, first I would have a chaperone in the room and I would wear gloves. And then I would ask permission. And if given permission, I would check the, inspect the breasts first. So I would look for puckering, retraction, or any like skin changes. And then I would, after I inspected them, I would have them lean back. And then I would inspect it again, and I would look for puckering, retraction, or any skin changes. And then I would have them lay completely down supine. And then I would inspect it again and look for puckering, retention, or any skin changes. And then what I would do is I would have them put their arms above their head, and I would palpate the breast with one hand over the other, and using my fingertips, I would start from the nipple areola area, and I would go in a circular motion outwards, and I would make sure to palpate the talus spence, and then I would also look for active and passive expression. So I would put my hands on either side of the nipple and just push down and slightly inwards on the breast, and then I would do this, all of this for each breast. And then I would check the axillary lymph nodes down here, and then I would also check the supraclavicular as well, lymph nodes, and that would be it for the breast. And then I would, if this were a woman, I would do a vaginal exam. So I would make sure to look at the skin around the vagina, that hair is appropriate, that there is no redness, there are no lesions. I would make sure to make that the labia and the vulva, there's no redness or lesions. And then I would spread the labia, and I would look at the urethra to make sure there's no discharge and there's no redness. And I would look at the vaginal opening and make sure there's no redness or discharge coming from there. And then I would make sure to palpate, I think it's Bartholin's gland, or the gland of Bartholin. And then if this were a man, I would do a inspection of their genitals, and I would make sure to look at the shaft and the glands of the penis as well as the testicles to look for any lesions or piercings and any masses on the testicles. I would look at the urethra to make sure that there is no discharge or any redness on the urethra, and then I would also do the chromatics reflex, and where I would put my hand on the inner thigh and just gently rub up and see if the testicles rise. And then I would do the rectal exam to check prostate on a male. So I would have them bend over the table, and then I would ask them to point their feet inwards, and I would have a glove on, and I would lube up my finger, and I would insert it into the rectum. I'd also make sure there's no lesions or anything on the rectum, and then I would palpate their prostate to make sure that there is no enlargement and or tenderness or any swelling in there. And